I'm going to show you how to fix your knee pain by correcting muscle imbalances. Whether it's from a meniscus tear, patellar tendonitis, or even knee arthritis, the underlying issue is often the same. Weakness or imbalance in the glute muscles, the quads, the hamstrings, or even the calves will put extra stress on the joint, and that's what leads to pain. Hey everyone, Dr. Jeff Peng here. I'm a sports medicine doctor currently practicing in the San Francisco Bay Area, and in treating thousands of patients with knee problems, I've seen firsthand how much muscle imbalances can contribute to pain. So in this video, I'm going to show you 5 exercises that target and fix those weak links. These movements will help your knees feel stronger, more stable, and get you back to moving pain-free. The first exercise is the Bulgarian split squat. To do this, stand a couple of feet in front of a bench, step, or a sturdy chair. Place the top of one foot behind you on the surface and keep your other foot planted firmly on the ground. Lower your body straight down by bending your front knee, keeping your chest tall and your core engaged. Go as low as you can comfortably, ideally until your front thigh is parallel to the floor, then push through your front heel to return to the starting position. Start with 2 to 3 sets of 8 to 10 repetitions on each side, and if that feels easy, hold a pair of dumbbells to make it more challenging. The Bulgarian split squat is one of the best exercises to correct muscle imbalances because it isolates each leg individually. It strengthens the quadriceps and glutes while also engaging the hamstrings and stabilizers. Most people naturally have one leg stronger than the other, and this exercise exposes and corrects those differences. By balancing out quad and glute strength, you take pressure off of the knee joint and reduce the risk of pain. The second exercise is the step up. Find a sturdy bench, a box, or a step that's about knee height. Place one foot firmly on top and lean slightly forward at your hips. Push through the heel of your front foot to lift your body all the way up until you're standing tall on the platform. Slowly lower yourself back down with control, keeping your weight in the working leg rather than pushing off with the back foot. Aim for 2 to 3 sets of 8 to 10 repetitions on each leg. If you want to progress, you can increase the height of the step or hold dumbbells at your sides. Step-ups are a fantastic way to build functional strength because they mimic everyday movements like climbing stairs. They specifically target the quadriceps and glutes, but also require balance, coordination, and stability from your core and your hips. By strengthening each leg individually, step-ups help even out side-to-side differences and keep your knees from absorbing unnecessary stress. The third exercise is the side-lying hip abduction. Start by lying on your side with your legs straight and stacked one on top of the other. Rest your head on your arm or support it with your hand. From here, slowly lift your top leg upward toward the ceiling, keeping it straight and your toes pointing forward. Pause briefly at the top and then lower it back down with control. Perform 2 to 3 sets of 12 to 15 repetitions on each side. Now, if this feels too easy, you can add an ankle weight or loop a resistance band around your thighs to make it more challenging. This movement is especially important because it strengthens the gluteus medius muscle. This is a small but critical muscle on the side of your hip. When this muscle is weak, the knee tends to collapse inward during walking, running, or squatting, and this is going to create extra stress on the joint. Strengthening the gluteus medius restores hip stability, and it also keeps your knee in proper alignment and significantly reduces knee pain caused by imbalances. The fourth exercise is the single leg Romanian deadlift. Begin by standing tall with your feet hip-width apart and a slight bend in your knees. Shift your weight onto one leg and hinge forward at the hips, letting your free leg extend straight back behind you as a counterbalance. Keep your back flat, your core engaged, and lower your torso until it's almost parallel to the ground. From there, squeeze your glutes and your hamstrings to return to the upright position. Aim for 2 to 3 sets of 8 to 10 repetitions on each leg. You can make this more challenging by holding a dumbbell or kettlebell in one or both hands. The single leg Romanian deadlift is essential for strengthening the hamstrings and glutes, which are often underdeveloped compared to the quads. When the hamstrings are weak, the front of the knee ends up taking on much more stress, which can lead to pain over time. And so by building posterior chain strength, this exercise helps restore balance between the front and back of the leg, and this is going to improve stability and going to protect the knee. The fifth and final exercise is the single leg calf raise. Stand tall on one leg with your foot planted firmly on the ground or on the edge of a step if you want a larger range of motion. Place your fingertips lightly on a wall or a chair for balance. From here, push through the ball of your foot and lift your heel as high as possible. Then slowly lower it back down with control. Perform 2 to 3 sets of 12 to 15 repetitions on each side. If body weight feels too easy, you can add resistance by holding a dumbbell in one hand or wearing a weighted backpack. The calf muscles play a bigger role in knee health than most people realize. Weak calves reduce ankle stability and force the knee to take on much more load during walking, running, or even jumping. By strengthening the calves individually, this exercise corrects side-to-side differences. It helps improve lower leg alignment, and it helps take pressure off the knee joint. These single leg movements help address the underlying biomechanical issues and weaknesses that drive knee pain. You can do them 2 to 3 times per week, and it's important to gradually build up by adding more repetitions, more sets, or more weight over time. But single leg work is only part of the solution. It's just as important to strengthen your body with compound movements that train multiple muscle groups together. That's why in this next video, I'll show you the other key exercises you need to finally fix knee pain for good.